Now, 14 new COVID-19 cases were reported. They included 2 cases in the community.
The other 12 were imported and placed on stay-home notices or isolated when they arrived in Singapore. More details will be released later tonight.
Meanwhile, no cases in the foreign worker dormitories had been reported for about a month until a construction worker staying in Seatown dormitory tested positive last week. And 2 days ago, on January 16th, the Health Ministry reported another separate positive case from Tuas South dormitory.
Both unlinked cases were picked up during rostered routine testing. Well, we have journalist Kok Yu-Feng to share more. Yu-Feng, hi. You spoke to several experts about cases springing up in the dorms, but they say there's no cause for alarm. How come?
In these 2 cases, it's most likely they are sporadic. And the main aim of the routine testing is not to prevent infections, but to find them and break the chain of transmission as quickly as possible. And that's what's being done right now in the dorms. And so hence, there's no cause for alarm. Yeah.
But why are there cases in the first place, given that our foreign workers are still under tight restrictions, staying in their dorms, except to go to work or run essential errands? So how could have these positive cases happened?
I think at the moment it's not very clear how the workers got infected. I mean, one possibility, for example, in the Seatown case, he's a new arrival from India. So one possibility is that he contracted the disease while he was in India and before he flew into Singapore. Although this is very unlikely because that would involve a very long incubation period, and he had 2 negative tests, so that is very, very unlikely that will happen. So the more probable explanation is that he got infected here in Singapore after he got out of quarantine. So all new arriving foreign workers need to go through a 14-day SHN. So it's likely that he had contracted the disease after he exited his SHN. But it's not clear whether or not he got it in the dorm or whether he got it at work. But both are also possible. So it's still too early to tell right now. Yeah.
Right. Well, Yu-Feng, are these experts saying that there must be more that can be done? Do our foreign workers, for example, need more measures?
So I think at the moment, both experts are saying that the RRT is quite effective in picking out new infections and breaking the chain of transmission. But of course, every dorm case is a concern because you never know when there might be latent infections within the dorm as well, and it could lead to a very fast spread of the disease, especially in such a communal environment. So I think one expert is saying that these new cases underscores the importance of getting vaccinations early to the migrant workers as well, because they're also at risk of getting infected by COVID-19.
I see. Well, thanks very much, Yu-Feng. That was journalist Kok Yu-Feng, and you can of course read his piece at straitstimes.com.